Bonjour Y'all. Welcome to Wellness for Everybody. I'm Amanda. Today I'm going to go over some things you can do if you have some back pain that could stem from degenerative disc or any kind of spinal diseases or things like that. Make sure that anything you do when you've got diagnosis with back problems that you are cleared from a doctor to do these. Usually simple, non-aggressive stretches are okayed by a doctor, but just make sure you have that clearance first. So the first thing I'm going to show you is just a decompression position. So we're going to lay on our back, and anytime you're laying on your back and you've got spinal issues, a slight bend in your legs helps take the pressure off the spine. So just keep that in mind. If you're laying on the floor, maybe put a rolled up towel or a pillow or something under your knees, and it takes that pressure off the lower back. So I've got a little bench here. You don't want something that's as high up as a full chair. It just needs to be something with a little bit of height on it. And we're going to simply rest our legs up as we lay back. And this is just a decompression position. It's going to allow the spine to relax without the pressure, again, of the knees being flat on the floor. And so you can just lay here for a little while. And this is actually a pretty relaxing position. So just lay here, feel the relaxation, breathe, all while getting a decompression done. Pretty simple. The next one, I'm going to have to explain to you how to do it. I don't have the means to do it here, but this is good if you're laying in the bed. You can just roll over to the side on the edge of the bed. And I'm going to show you how to do it. Obviously, I can't show you completely, but you're just going to take your legs together and allow them to hang off the edge of the bed. You're on your side. Don't roll over with it. Just stay on the side and allow that pressure of your legs hanging off the side just to kind of decompress that spine. So, all right, we'll do some stretches. So the first one we're going to do is knees to chest. So you're laying on your back, your knees are bent up with your feet on the floor, and you're just going to take your knees into your chest, wrapping your arms around. And you can rock side to side if you'd like. It kind of gives a gentle massage to your lower spine. Just make sure you're breathing, and make sure you're not feeling any pain. And the next one we're going to do is take one of the legs and lay it long, keeping the other one pulled in. And you take and just gently side to side with that. That's fine too. That gives you a little bit of hip stretch at the same time. And just make sure you're switching sides. Okay, gonna release the leg, bring the other one back up so both knees are pointed up, and we're just gonna windshield wiper our legs. And all that means is you're just gonna take your knees and let them fall side to side gently. And that gives your spine a gentle rotation. And it's loosening up the hips as well. And when you feel comfortable with that, we'll come back to the center. We're going to do a figure 4. So all that means is you're leaving one knee bent up with your foot flat on the floor. You can take the other one, cross over, and you've made your figure 4. And we're just going to breathe here. And we can get a little bit more stretch with that one. If you want to take that knee and pull it in towards the chest. Gently release, and we're going to switch sides. Pulling that knee into the chest. Okay. We're going to grab a band. If you don't have a fair band, you can use a towel, a belt, anything like that. And we're just going to loop it around the foot. We're keeping the other knee bent. So foot stays flat on the floor and the knee's bent. Remember, that's going to protect your back. And we're just going to take this belt or band or whatever you have, and we're just going to try and stretch that hamstring, all while protecting the back. Now, if you can't get this far, if this is as far as you can get, that's perfectly fine. This is just to simply have you hold on and try to gently pull just a little further. And we're switching sides. Okay. So those are the stretches I have for you today for any back pain, degenerative disc disease, anything like that. Again, always make sure that a doctor tells you it's okay to perform these things. Typically, gentle stretches like that are good for you. You want to avoid any heavy lifting, any strain on the back. So if you do pick something up, make sure you're lifting from your knees, not your back. And again, with any of these stretches, make sure you don't feel any pain. So if you've liked what you've seen, and if you've learned anything, make sure you like the video, share the video, subscribe to the channel, and I'll see you next time on Wellness for Everybody.